Hi, my name is Danielle Terry and my partner is Sarah Henneman, and we are here to discuss a proposal for MTM services in a WeCare Center of Excellence for Women's Health. There is a need for pharmacy services through MTM. WeCare deals with many disease states: osteoporosis, COPD, hyperlipidemia, hypertension. There's a lot of polypharmacy due to these disease states and the fact that many of our women patients are the average age of 62. And because of the polypharmacy and the lack of education, we have adherence issues. And these adherence issues should be able to be helped by proper education and then the decrease in polypharmacy. There has shown to be past success with MTM in the primary literature. It is shown to have improved clinical incomes overall, decreased cost savings, increased cost savings due to the decrease in adverse drug reactions, and then overall patient satisfaction was shown in these studies as well. The operations would be organized in a similar manner as the clinic, with pharmacists, physicians, and other staff performing their daily duties within the clinic, and the MTM having a separate private area. The scope of practice would mean that we would not need to have any need for prescribing, as there is a multidisciplinary approach. If we do find that there is any need for intervention, then we can work with the physician or the clinical pharmacist to help the patient. And then the hours would be 9 to 5 Monday through Friday, 9 to 1 on Saturday, and closed on Sundays. And they would have the option, if they called off hours, to either go to an answering machine if it's a non-emergency or be directed to the hospital if there was an emergency. Treatment algorithms will be the use of the guidelines. So we will use CHEST guidelines for AFib, ADA for diabetes, JNC7 for the hypertension. We will be incorporating the new lipid guidelines for hyperlipidemia, the ACC/AHA 2013 guidelines. We will use the GOLD guidelines for COPD and then the AACE guidelines for the postmenopausal osteoporosis. MTM services that we will be providing as pharmacists will be the comprehensive medication review, counseling, monitoring, education, and then allowing the patient to give questions that can be answered at any time. And all of these will be discussed in detail. Here's an example of what the patient can bring along with them after they leave the office, after the comprehensive medication review. So it's going to be written in their language. It will give the medication, its indication, and then also the directions for use in their language and their prescriber. Something that is special is that if they decide to stop or are instructed to stop, they cross out the medication, then give the date and reason why they stopped using it, which can really provide help to the physician or the pharmacist. Monitoring can be done quarterly. In fact, that's going to be things like A1C or some of the blood work. Per visit and self-monitoring are going to be things like blood pressure, a lot of the blood glucose, and then INR when it comes to warfarin. INR can also be self-monitoring in some circumstances. Adherence is going to be measured by their refill records, and then as well as what the patient tells us, and then hopefully what we're seeing in the goals when we see some of these monitoring parameters. Education is one of the main things that we're going to be offering. So proper use of medications is going to be how they're going to take it in respect to the dose, the dosage form, the administration, and then with use of food. We are also going to do proper vaccination schedules for women, the flu vaccine, the Pneumovax, and then vaccinations special to their disease state or age. And we're also going to tell them why they're important and maybe offer certain screenings for women, such as pap smears, mammograms, and then BMD for osteoporosis if applicable. Payment for services will be billed through MTM or other health providers as long as we follow the proper Medicare protocol, and this will be shown in the provided documents that show the MTM charts, which so far are following that protocol. And then as we have shown and we will show, this should show a decreased cost for the clinic overall through decreased adverse reactions and decreased polypharmacy and increased adherence. So in summary, adding women's health clinical pharmacy services at the WeCare Clinic through MTM would reduce the problems that we're seeing with polypharmacy and adherence, improve the care to the patient through these actions, improve the overall satisfaction through the patient, which has been seen in the primary literature, and then increase revenue by decreasing that cost, by decreasing adverse reaction, by being able to collaborate closely with the physicians and other staff. And so I hope that you will consider us and consider this proposal. Thank you.